want to show how I am. I don't want to show my fat body, but.
Okay, that's hard here. Okay,
Okay. Oi, pessoal. Sou eu aqui no dia 27 de junho de 2014. Nós iniciamos o vídeo one day antes da cirurgia e esse é the day da cirurgia. Estou aqui no hospital, eles já me equiparam com alguns equipamentos básicos para a circulação, para ajudar a circulação, para você não ter nenhum problema durante a cirurgia. E também já estou no soro e tenho todos meus nomes, minhas necessidades aqui. E, ok, Derek, go ahead.
Okay, we're here one day after the first video, we're the day of surgery, June 27th, 2014, and we're just preparing. She's already taken some muscle relaxers and that type of thing. She's got all of her documentation on her wrist, and she is about prepared to do surgery in about 1 hour. Okay, Lene?
Yeah. Eu estou, como vocês estão vendo, eu estou já equipada para a cirurgia. Já falei com os médicos, com várias enfermeiras. E com o médico já tirei blood, já tirei o sangue para os testes, já fiz teste de gravidez. Eles já começaram a me dar remédio para relaxar. E estamos aqui, parece que está tudo bem. Hoje vai ser o dia da cirurgia. E vou voltar depois da cirurgia. Go ahead, Ellen.
Okay. Well, as you all can see, she's got her all of her surgical necessities. She has her leg massagers. She's got her IV going. She's spoken with several nurses, several doctors. We will see how things go. She just wants to thank everyone for all the help on YouTube, and she hopes again to impart some information and some, I guess, experience to those who may come or may be looking for some information or experience on YouTube. Do you have anything else to say?
Não? Vou ver vocês depois da cirurgia.
And after surgery, we will see you all again.
Bye-bye!
Eu também gostaria de falar um pouco de como eu me sinto, como tem sido. No dia before, no dia 26, que quando eu fiz o primeiro vídeo, eu estava bem calma, bem normal. Hoje é o dia da cirurgia, dia 27, eu estava bem nervosa, por isso que eles dão, eu acho que é por isso que eles dão remédios para te acalmar antes de entrar no processo. É um pouco assustador, não pela cirurgia em si, porque são praticamente são 2 cortes, um na barriga, né, e o outro nas costas. Realmente estava nervosa, mas agora eu estou bem. Go ahead, Aaron.
So basically, she was saying that she is. Yesterday she wasn't too bad off as far as nerves or anxiousness. Today was a little bit more of that. She had a little more anxiousness, a little bit more nervousness, and the doctors, of course, well, the nurse gave her the muscle relaxers and some stuff to basically cocktail to calm her down. Now she's just no waiting. She's a lot calmer and just waiting to get started.
Okay.
Thank you very much.
Yeah.
Nice to meet you too.
I'm gonna look at your bracelet here and make sure we've got, and I know everybody does this to you, but I wanna make sure we've got the right name. Tell me your full name
Angela Satisfied.
and your birthday.
9/2/72.
Okay, and tell me what Dr. Frisch is doing for you today.
Eu dou anterior, intervalo, lumbar, posterior.
Alright, so we're gonna go on your stomach first and then maybe flip you on your back and go into your back.
And
Okay.
fusion.
Okay, yeah, fusion.
Yeah.
And where's your pain mostly?
My, it's hard because my problem is not about pain, it's
Mhm.
about mobility.
Mobility, okay.
Yeah, but if you want to ask my pain is between my low, 95, and
Mhm.
my head, and was just the right.
Mhm.
3 days ago, started my left.
So both sides then?
Now.
Now, okay.
Before was just, I feel 3 days tingling in my left.
Okay. Did they take any blood test for pregnancy for you?
Mhm.
And it was negative?
Mhm.
Okay. And are you a diabetic?
No.
Okay. Are you on a beta blocker for your heart? Are you on any medications for your heart?
No.
Okay. Okay. Do you have any metal in your body from any previous surgeries, like broken bones or anything? Okay. Good. And the last time you've had something to eat or drink?
8:30.
8:30 last night? Okay. Okay. Well, depending on whether we flip you or not during the procedure, that'll depend on how long it's going to take. If we don't, then this is probably about an hour and a half to 2 hour procedure.
Okay.
If we do flip you on your stomach and we work on your back, then that's probably going to add another hour to the procedure, okay? So then when you go to recovery room, you'll be waking up for about an hour in recovery room. So you're looking at anywhere between 2 to 3 hours back in the operating room, okay?
Mhm.
And then you'll be waking up and add another hour onto that in recovery room. If it's longer than an hour and a half or 2 hours back there, I can give you a call out to the waiting room if you're going to be out there.
Okay, yeah.
Okay? And we're going to take good care of you, okay? You will get a Foley catheter back there, okay? Because you are staying the night. So we're going to monitor that because they don't want you getting up, tonight. Okay?
Okay.
So, any questions for me?
Yeah, true. When you say May will go to the back, that it should be proper. Quando ela fala May, pode ser, né? E é ou não é? Porque
Oh, okay, she wants to know for certain if it's going to go through the back or not.
Right now, it's posted, the actual consent that you signed
Sure, yeah.
reads we are going, but sometimes he gets in there and he can do it through the stomach.
Okay,
And
it's not
and then we don't have to flip you, and that's kind of what we're hoping for, but he always puts it in the consent and he always tells you that that's what we're gonna do, but sometimes if everything, if everything goes great and perfect,
Mhm.
then he might be able to do it all through the stomach. But
if
he
it
won't be able
feels-
to tell until he gets in, even the fusion, he won't be able to tell them until he gets inside.
Okay.
Because I understand how can do the front to take care of the disc and put it back, but I don't understand how can do the front to fuse.
We do it all the time.
You do? Okay. The other question is, Dr. Appleby
Mhm.
told me we may have the option to decide if it will be bikini line or vertical.
Vertical or
Mhm.
so she'd like that.
He told me to tell you guys.
Okay, so you prefer
The
to go
bikini.
this way.
The bikini, yeah.
Okay, I'll tell him that and see what he says. I'll
No, he told me, we tell you and that
And then I'll tell him?
see, that he see if he can do or not.
Okay.
But he told me you should mark my bag.
Mhm. Did anybody mark you yet? Did Dr.
Well,
Frisch mark
Dr.
you?
Frisch marked
Just
her.
what you will do, but
Okay.
no, the line.
Right. Yeah. Okay. They normally won't mark the incision site until they get back into the
Okay.
room. They just initial where they're going to make the, where they're going to make, go, in the general area, they'll initial where they're gonna go in.
Okay.
But, and you tell him,
I will tell Dr. Appleby, because Dr. Appleby will be the one that starts the procedure.
because he told me you should mark in my bag.
I'll follow KL by
No, no, I understand, but do you remember what he said? She will mark, so it's okay. As long as you tell him,
I will tell him.
please.
Mhm, sure will, I promise, I
Mhm.
promise.
And do you know where is they call bikini line? Do you know where?
Why they call it bikini
No,
line?
where?
No, where?
Oh, where
In the
is,
back, yeah.
oh, well, your back is gonna be straight up and down.
No, in the bed, but where? I see it, where?
And right here, normally, the reason why they call it bikini line is because it is right at your bikini line, so it would be somewhere like right in here.
Okay, that's
Okay.
good. Because bikini line for me is here.
Oh.
Do you understand? But it's
Uh-huh.
fine, as long as,
Uh-huh.
fala
That's
pra
right.
fala pra ele, é longo, horizontal, is good.
As long as she says as long as it's horizontal.
If you can, of course.
Okay.
Yeah.
Because he says sometimes they cannot do it, but sometimes they can.
Right. And I don't want to give you false information, but you're fairly thin, and probably because you're healthy and thin, he probably will be. But I don't want to tell you yes and then you come out without. But I would definitely tell him, if you can do it, please go, horizontal.
Probabilidade que você vai.
No, I understand.
Okay.
Yeah.
We're going to take good care of
What's your name again?
you. Haley,
Haley, thank you so much. Okay?
you're very welcome.
Thank you.
And I'll give you an update if we're in there longer than 2 hours, okay? I'll call out to the waiting room and let you know, okay?
Okay.
If it doesn't go long with 2 hours, does it mean something or not?
No, it doesn't mean anything. It just means we did have to flip you on your back, and it all depends on when we get in there and see what he sees, and we do this every Friday we do abdominal, and then every day we do back surgery. So
Okay.
yeah.
Okay. Thank you so much.
You're very welcome.
Thank you.
Okay. Sorry.
Let's just sit up and stick here.
Yeah, give him that.
Mood is stuck under you.
Okay.
Okay.
You take all of this with you.
Oh,
Sorry.
no, it's okay. It's not your fault.
I'm gonna shut this. Sorry. Let me grab your ID for you. You okay?
Oops.
All right.
This stuff, yeah, I think it's the stuff we like.
Let me grab this for you.
Thank you so much. Dá beijo, dá beijo. Yeah.
Yeah.
Cheiro no pecozinho.
You do.
Yeah.
Oh, it's okay. Maybe he's scared of that.
Really good.
What's up?
Não, daí põe esse travesseiro no meu, por favor, põe o travesseiro no meu.
Like always.
Ok, this is the time. Te amo, filho. Te amo, okay? I love you. Hey, man.
Nico.
I love you,
What's
okay?
the 10 something on my
Gotta take care of my son. Please.
You're gonna see him before you know it.
Mm.
And be yelling at him, get that stuff off, clean up this room.
Yeah.
True. All right.
Okay.
Did you guys know where to wait? Are you gonna wait in the waiting room?
Is it the big one over here?
Yeah. So when you walk out, basically, it's the one. You walk down the hall, make a left, and it's right through this doorway. Ask Elizabeth. She'll show you exactly where to go.
Well.
Hello, how are you?
Are we gonna be coming back to this
I'm
room at
good.
all?
Do you have a
No.
party
So
hat?
we
I
need
want
to
you to
take.
take everything with you.
Okay.
Let me give you a hat. Well, let's get you a party hat.
Yeah. Segura
Oh my
tudo,
gosh,
pai.
they will put you
Yeah,
on
segura
video
tudo, pai.
too.
Yeah. You know what? We try, I just show the family and everything.
I just need to get a hat from right back here,
Okay,
sir.
okay.
You're fine. No, just let me squeeze by. We'll get you one when we get past the OR.
Alrighty. Yeah, your
Where's
bag.
Miss Renee?
You got your coffee.
We will take very good care of her.
All right.
Thank you for that.
No problem.
Yeah.
See, I wanna go on this one, but. Here, wait.
A little party hat. Alright,
Ok.
Say bye-bye.
Bye.
Yeah.
Just
shut
in
up.
time. I'll be
All
back.
right.
Eu já vou voltar.
Ah,
Bye.
much.
take good
Bye.
care of her.
Ciao, ciao.